We do this because we revise the way we did this so that we could improve the grant rating. So we're going to go over the RFA, the application process, and proposal narrative. Those are the key components. We're going to talk about what is an evidence-based program. It's not required that you use an evidence-based program, but it's important that you understand the difference so you can properly characterize what you're doing. We're going to learn how to write SMART goals. We're going to learn about writing the budget, and then we're going to talk about some common mistakes that we see when we review these that we've seen over the years. So the first thing is there are 4 areas that are defined by the Indiana Commission to Combat Drug Abuse. And these are the 4 areas that we kind of target with these grants. One is education, which is where prevention falls, treatment, interventions, and then justice services. Okay, so based on the 4 areas, the Tippecanoe Drug-Free Coalition has identified 3 problem statements, each with 2 goals. And these problem statements were developed based on the data we have for our community as identifying these are where our issues are. So we took a very very pragmatic approach this time and method to establish what our problems are. So the proposed programs have to address these problem statements and goals. Okay. And I'm going to say this about 5 times because this is like the most important thing. Each proposal can only contain 1 program or project. If your organization does multiple things, they have to be all separate proposals. Okay. We will not review multiple programs in one. Okay, so problem 1 and 2. Problem 1 is substance use and exposure among youth and young adults in Tippecanoe County is a concern. And our goal 1 is to increase available resources and services that support youth well-being and prevent substance use. Goal 2 is increase substance use prevention efforts. Okay, so you can see that the first one could fall into multiple categories. The second one would fall into that education prevention category. The goal. But problem number 2 is unmet basic needs can increase the risk of substance use disorder. So the goal 1 is to increase mental health services because we know unaddressed mental health is a huge risk factor for substance use. And then increase resources to combat homelessness because we also know from our data that that is unmet need. Housing is a huge unmet need. And a risk factor for substance use. Problem 3 is that alcohol is one of the most commonly used substances in the county, contributing to arrests, deaths, and use among individuals of all ages. So goal 1 is to provide sober social events. And goal 2 is to decrease the overall overuse and illegal use of alcohol. So the application is available through the Tippecanoe County Drug-Free Coalition website under the Tippecanoe County government website. It is at drugfreetippecanoe.org/grants. I believe there's handouts that have a QR code to it as well. But if you go to the website on your computer, you're going to scroll down and see this click here box, and that's how you access the application. You should read through the entire application before you get started so that you know how it's broken up into sections. And it's highly recommended that you write the large blocks of text that are required in a Word document. So you can use spell check, you can use word counts if you need it, you can do all your editing there and copy it and paste it perfect over into. So the first section is information about your organization and who is submitting the proposal and who is the program coordinator. The person submitting does not have to be the same person as the program coordinator. So there's the option to fill out 2 different. You have to provide a name for the program. So it could be, because most organizations, it's a program within the organization and not just the whole organization. And then some programs may be only partially funded through this grant mechanism. And so we ask for the total cost. So if your program, let's say, costs $100,000 a year to run, and you're asking drug-free for $20,000, we want to know that your program costs $100,000 and where you're getting the rest of the money. Okay. The next step is you're going to select your problem statement and goal. So again, each program should address one problem statement and one goal. If you think your program kind of dances between two, pick the one that's the strongest. And then again, if your organization has more than one program, you will need to fill out a separate post each. So the proposal narrative is broken down into 4 pieces. This is the bulk of the writing of their program. So the first thing we want is a brief 100-word maximum description. This is going to be used for marketing purposes. So when we put out, these are the projects going on in our community, this 100-word summary of your program is what's going to go in there. Again, make sure it's about the specific project that you're proposing, not necessarily your overall organization. The next thing you have is the full description of activities and services your program will be providing. So what is it that this program that you're proposing is going to do? This is why I say read through each section, because the next section is the target population. So this is where you're talking about, this is who we're trying to reach with our program. This is how many people we think we can reach. This is how many we want to reach, all of that kind of description. And then the last box, the 4th box, is the description of the evidence base or justification for not using evidence-based programming. Again, you do not have to use evidence-based programming to qualify for this funding, but if you choose not to, tell us why. Why is this a good funding? Good thing to fund. And again, what am I saying again? One program per proposal. I can't overstate this. Okay, then how to make this perfect? Read everything through. Read it out loud. Okay, so I read my writing out loud. It feels a little silly at first, but you'd be amazed at what you catch when you have to actually say it out loud. Use spell check and grammar check in Microsoft Word. Ask as many people as you can to read it before you put it in. Make sure it makes sense to everybody else. Sometimes when you get very close to something you're writing, it makes sense and you leave out a whole sentence. That's really important. And you don't realize it because it's all straight in your head, but somebody else reads it. They're like, I'm confused. You realize you forgot a sentence. And then rewrite as needed. If this is a continuation application, so this is a program you've done before that you're funded for now and you're asking for continuation funds, make sure you provide some evidence that the program was effective. Okay. Now this is why, and in the past, or that you've made changes to be more effective. So if you were able to reach 500 people with your program last year and you intend to reach another 500 this year, that is evidence you were effective in your program because your target was to reach a certain reach that many people. If you were not able to meet your targets before, say what you changed to make it better. Like we could only reach 200, but we realized that our marketing was not on point, and so we're expanding our marketing to be able to reach 1,000 people. Whatever. That's what we kind of want to see in that narrative there. Okay. Evidence-based programs. So evidence-based means that the program has been rigorously evaluated using sound scientific methodology to demonstrate efficacy. Okay. This means there are published studies that report the findings of the evaluation. Okay. You are not required to use an evidence-based program. There are a lot of really phenomenal homegrown programs, and we are happy to fund them. You just don't tell us it's evidence-based if it's not evidence-based. Okay. We're not going to ding you for that. If you say it's evidence-based and you provide no supporting documentation, you don't provide any references for where it's been shown to be effective, then we will ding you for that because you didn't provide the evidence. Okay, so that's what is evidence-based programming versus non-evidence-based. Okay, and then again, it's evidence-based has been tested in a population for effects and outcomes. There are published articles that you can provide as references in your application. And it's been the best evidence is when it's been tested in different populations. So we know it works across different. Non-evidence-based or homegrown programs based on ideas of staff and leaders in the organization. It's a new program that's never been implemented, so there's no testing of it. Or it's a program created in response to a need to serve. Again, we love both. Just make sure you know where. Okay. So now I'm going to hand it over to Amanda for a little bit, and she's going to walk us through how to do SMART goals.
All right, guys. I'm still working on a few SMART goals over there, so I'm gonna go over some stuff, and we're gonna take like a quick break, and we're gonna break it into some things of you. So, how many of you have ever written a SMART goal? Okay, so pick on anybody. So, what was your SMART goal about?
I think SMART goal. Three SMART goals.
Right, yeah. So so you're specific, it's measurable, right? It's achievable, hopefully. It's relevant to the patient and it's time bound. So whether that be 1 day, 1 month, 2 weeks, 1 year, 2 years. So that's what we're looking for with time bound. So specific, what are we trying to accomplish? So when you're writing those goals, just think in your mind, what am I trying to accomplish? Am I trying to figure out how to get more milk on the shelves in the store? Am I trying to figure out how to get more candy for kids at Halloween? Like, I'm trying not to be specific to anything here, so I try not to give anything away in our presentation. But what is your specific goal that you're trying to accomplish? And measurable, whether that be we're trying to we have cops and goblins at the PD. So are we trying to get secure pieces of candy for the kids for that event? So like your quantity would be that 30,000 pieces of candy. If it's individuals, it's are we trying to help 1,000 individuals? Or are we trying to help community? Are we trying to help 200? Like if it's a community, 200,000. Achievable, make sure your goal is achievable. Don't write a SMART goal and say, we're going to help 1 million people with our program the next year. That's probably not achievable unless you are really a go-getter and you're going to help 1 million people. We want something that's more achievable. We're not looking at goals. Like Rebecca and I and the rest of the committee that's looking at the goals aren't going to be like, oh, they said they're helping, 500,000 people, so we have to give them that money. That's more bang for your buck. No, we're looking at whether that's achievable as your goal. Relevant. Is it relevant to what our problem statements are? If you're writing a goal about securing candy for LPD's cops and goblins, probably not going to be relevant to what the DFC does, right? So make sure that you look at our problem statements. Did everybody get? Make sure that you have one of these before you leave, because that will give you problem statements and goals. They're a little bit different this year. We have statements and each have 2 goals, which makes it a little bit easier on us. Time bound, whether that be you're going to do this in a year, you're going to do it in 2 years, which is okay. Don't think that you have to write your goal and say that it's going to happen between the goal timelines, right? This might be something that is a 2-year project, and that is okay. When we're reading through these, we understand that it is a 2-year project. It might be a 3-month project that you're trying to do. You might be trying to do a pilot program, like a 90-day a trial. We don't care about that part. We do care that if you write that you're going to do it in 2 months, that's achievable. or if you're going to write that it's going to take 2 years, that it's achievable. That's what we're looking at. We're looking at all these things together and making sure that you're able to achieve that goal. And we're going to make sure you stay on pace with that goal. And if you're not staying on pace, what we can do to help stay on pace with that goal. Did you go to? Old guys can't see this. Yes, that. Okay, so this is where you're gonna take a break because I'm still making a few sheets up because I was gonna use something and now I've decided that I'm gonna give you guys these projects that you're gonna work on together and you're not gonna all work on the same SMART goals. So take a break and get a snack and then get into groups. I need get into groups of 3 and then we'll have one group of 2.
Snacks and drinks are in the kitchen.
Talk to each other, communicate with each other, network. group to report out. What, do you guys need more time? Say it out loud. So if it's in your head, it's fine. So. So get started takes me to the YouTube for the 25-26. This one. So is Stephen the first one?
No, Josh.
Okay, so this is from Joshua, and his is by June 2026, partner with at least 3 waste management companies and 2 community organizations to launch a countywide campaign addressing illegal dumping. Reduce reported illegal dumping incidents by 15% in Tippecanoe County by March of 2027, as tracked by County Environmental Service reports. Recruit and train 30 to 50 community volunteers within 12 months to monitor high-risk areas and educate residents about disposal alternatives. By addressing illegal dumping, the county will protect local waterways and soil quality, reducing recycling, contamination, and promote healthier living environments, all tied to public outcomes. Implement a pilot dump-free Tippecanoe program in 2 neighborhoods by March 2026, and then expand countywide by March 2027. And so his whole goal is by March 2027, reduce illegal dumping incidents in Tippecanoe County by 15% through a coalition-led education campaign, community monitoring, and expanded recycling access. Good job, Joshua, doing that all by yourself. So that was a lot. Stephen Horrocks has did a whole public education campaign. His specific was develop and implement a countywide awareness campaign focused on the dangers and costs of illegal dumping. Educational mailers sent to every county household with instructions on waste and recycling options, posters and signage at parks, trailheads, and high dumping areas, social media and local radio campaigns, school-based education to engage students. His major roles are distribute educational materials to 100% of county households, install 50 signs, and identify dumping locations, and reach 10,000 online engagements across county accounts, launching an educational program in at least 10 schools. Achievable county staff can partner with Purdue University Waste Management and nonprofits for messaging support and volunteers. Relevant awareness and education reduce dumping by promoting positive understanding. Time-bound launch campaign within 6 months, household distribution. Again, the signs for 12 months, and dumping reports after 18 months. Oh, we have another 2. Okay, Vera Schaefer. Specific reduce illegal dumping incidents in Tippecanoe County by raising community awareness, increasing proper disposal options, measurable decrease reported dumping cases by 30%, and increase recycling program participation by 20%. Achievable, partner with local government, schools, and waste management service to launch an educational campaign and improve access to disposable facilities. Relevant, this goal directly addresses environmental impact of dumping and supports continuation of recycling programs, time-bound. Achieve these outcomes within 12 months, starting January 2026. That was really good. So I like how you kept everything in where it needed to go. With like, for example, on Joshua's, you didn't have to do the time bound on each one. Just remember your measurable. You can keep that in the measurables. Don't overthink these goals. Just try to stay within those lines, the specific, the measurable, the achievable, the relevant, the time bound, and then write your goal after you get those. So good job, guys, online. Okay. Well, okay. Yeah. That are only eating ramen. Doing or accomplishing our goal would be to provide additional food options, essentially connecting up with these. And also then bring some type of education to the student. And then making sure, I don't know, our pantry, with considering communities, pantry.
you could go a couple measuring it. You could measure, look at what the sodium levels are. And hopefully visiting the pantry and then hopefully seeing a decrease in those areas. Achievable is, again, we could accomplish this by getting involved with the H2 pantry because they like having service projects. And we could probably even find a class that help with drug coverage. Different types of other than ramen. Especially if they start freshman. And the time frame for this would have to happen within the academic year. So start from the fall and check at the end.
So your full entire right? Okay. So basically, you'd like to increase pantry participation by 20 to 30 students. So by 15% during the education level or education or the call whatever. Sorry, my brain is like still surgery brain. So during the academic year is what I meant to say. Yes, sure, I get all that out. Okay, good job, guys.
So our problem statement is a local candy factory has went on strike in the following causing panic citizens.
Yeah, that's fine.
We put helping to communicate the situation to reduce data research. News updates. Knowledge. A is media releases, text news updates, alternative media, posing in good faith with other companies. R is providing interventionists, because we kind of tied in the relevance with the DFC stuff of like, technically candy for Halloween is an unmet need. So we could help provide our health resources by providing an interventionist that can help with reducing the anxiety and panic. And then for T, we have lab toward 15. So the goal is to provide daily updates in an interventionist to reduce panic in local citizens.
So there's a lovely soft version.
Well, and you guys are increasing mental health research too, so. Okay, go ahead, guys.
Okay, so statement is a local nursing home is having patients to engage in activity time leading to participation. So for specific and the goal for long-term goal we are going to achieve is 80 to 90% of the patient will attend activities to prevent depression and decrease the risk or use of substances. So as we put having patients attending activities, making attending interesting. Based on patients' interest, ability, and choices, also based on their culture, and provide some incentives like playing bingo with bingo voucher, so they can utilize to get or buy something later on, what they like or need. And for measurable, we put in 4 weeks increase patients' attendance by 25%. Achievable, yes, by first we can do surveying or interviewing patients of their likes of activities and interest, and then second we put involving staff, nurses, age therapists to encourage patients and reminding to attend the activities. Third point, we put putting activities on daily or monthly that a nurse patient can plan, and then activities, making activities fun and during the activity. Then we write if it is relevant. Yes, decreasing the isolation by increasing activities and attendance. And for DFC, we put if the time relevant. Yes, in 4 weeks, for 25% retention, and then we can upgrade every 4 weeks by 25% to reach to our goal to 80 to 90% attendance.
Okay. Good job. You guys even went a little bit further on the time, and that's okay. If it's something like that, like 25% in, 4 to 6 months, and then a longer goal would be 50% in 12 months. It's okay to do that as well. So that's great. Are you guys trying to figure out who's gonna report? It noticed that I only gave you problem statements and I didn't give you any goals. So it's hard for you guys to like, oh, what did they mean by that? Or what is causing the problem? So these guys had kind of a tough one. So
Our problem was a local farmer is losing livestock at a rapid rate, leading to so so our goal was to decrease the amount of livestock losses. We will assess 100% of fence weaknesses that allow predators to enter and buy one protected animal, in this case, a llama, all within 1 week. Livestock longevity will be assessed for effectiveness as well as milk and meat production. We said we're going to assess fence security and identify predators are entering. For our measurable, we will identify 100% of fence weaknesses. And we'll buy one llama, which is what we'll do. Is this attainable? He said, sure. In our 9 months, he said I should take no more than 2 months using it. And stick, we said, yeah, llamas help keep predators away, and more cows equal more milk and meat, which equal better milk. And then timeliness is weeks. Llamas will be purchased within 24 hours because we learned that there's a large Facebook.
so super exciting. To purchase the llama within 24 hours. Okay. We always like you guys to get into groups. It helps you guys network and come up with different things and helps see different sides of stuff. I know like Donna's in nutrition at Purdue. How she got that one, I have no idea because these were completely random and you guys picked them. But but it's nice to see other people's ideas, right? Because you guys come from all different backgrounds. So getting together and just like brainstorming ideas, and that helps you guys when you're writing your grants. Make sure that you get with your colleagues and brainstorm these ideas and kind of bounce your SMART goals off of them and say, hey, does this make sense to you? Because if you say, hey, we're gonna, confiscate 100 drugs or 100 guns out of the school in 1 month. If I told Dan that, he'd be like, yeah, probably not achievable. So like, just know that just bounce it off of some of your coworkers and see, and always use us. You can always email us. Most of you have mine and Nicole's email. If you don't, we can give it to you by the end. Send messages to Rebecca. She can get with us. So we're here to help you guys. So thank you. And last but not least, there is a budget worksheet that is downloadable from the application. It is a fillable PDF. Okay. And narrative. So there's like multiple pages to it. Each page is a different category of the budget. So the narrative under each section should describe how the funds are used. So now to be concise but detailed. Okay. So what that means is don't ramble
one, but make sure you provide the details we need to understand where the money's going. So the first one is personnel. The next page is supplies and other expenses. The next page is training. This is any training that your organization would need to be able to do the project. Contracts, any contracts you have to do, and capital. So that's anything you need to purchase that is a physical item. So special considerations as you're going through these. Expenses should be requested with judgment and discretion. So it needs to be like germane to what you're doing for us to approve. Grant funds cannot be used to cover an individual's full salary. Okay, because a lot of people get funded here one time, it creates issues if you're counting on this funding year on for a position. So if you have somebody coming in I'm just using an example this year. So for example, this year, Recovery Cafe is doing some art courses. They have an art teacher who's coming in. They are covering her salary costs for those 2 hours each time she comes in. That is appropriate. If they were to have one of their staff members fully funded under this, that is not appropriate. So that clarify when we will cover salary and when we will not. And then capital expenditures must be accompanied by 2 bids. Okay, and there's a place in all the bids, you need to scan them all together into one document, combine that document, and upload them all together into one document. So if you say we're going to buy a new set of chairs for this project, we need 2 bids for those chairs so that we can see that it's a competitively priced item and that you're not just making up the number or picking one really expensive item. So common mistakes in these applications, and this is all funding applications. These are common mistakes people make. So the first one is always answer the question that is asked, not the question you want to answer. Okay, answer all the questions that are asked. So you don't skip any questions. Answer the questions or they appear in the RFA. So we have very clearly delineated sections. This should be easy to do, but in general, if you're writing a grant, you want to go in order because reviewers review things in order. And so if they get to a section and they're expecting to see something there, and it's not there, they're going to say it's not here. Versus reading down 5 more pages and oh, there it is. So they won't, that's hard for reviewers. Multiple programs. Again, one last time, if you have multiple programs, 1 proposal per program. And do not combine different programs with different goals into one grant. Target populations. Make sure you've clearly identified your target population. Okay. If you're working in schools, are you working with teachers? Are you working with students? Are you working with the coaches? Be really specific with who it is you're trying to target and how big that target population is. So if you say, I want to target Tippecanoe County School Corporation high schools, and we're going to we're trying to recruit 100 students, that's a reasonable target because there are in TSC among the 2 or 3 high schools in TSC, or 2 high schools in TSC, there are roughly 4,500 students. So if we're going to say there's 4,500 students and we're going to try and recruit 100, that's a reasonable thing to say. Right? If you were to say we're going to recruit 1,000 students from Central Catholic, I would say that's going to be tough because they don't have 1,000 students in their high school. So just make sure you've got that all kind of laid out, and then and then get that descriptive data and make sure you're targeting Tippecanoe County residents. Okay, although we do a lot of stuff, our donut counties here in Tippecanoe County. This is all right. Tips and tricks, write your proposals in Google Docs or in Word so you can spell check and grammar check and edit. Once you submit it, you can't go back and make changes. So make sure everything's in, read through it a couple times before you hit submit. And if you close out of the survey, you may lose your work. So I suggest looking at it, knowing all the sections, writing all your work separately, copying, and then planning it. I'm going to take an hour. Set an hour in case it does everything in and submit it all. The program description, okay, this is that first section of the narrative. This is 100 words. This is really truly 100 words because we want to use this for marketing. If you ramble on, we can't put that in our marketing. It really has to be. That's the only place there is a word limit, is in that description. The statement is used verbatim, so as you type it is how we will use it. And I would suggest writing this last, because once you've written all the other parts of your grant, you really know what it is you're doing, and you can write a nice, concise 100-word summary. Peer review, ask someone else to read your work before you submit it. Same as Amanda talked about with Smart Girls, bounce it off to other people, have them look at it. Give them the RFA and make sure you clearly hit all the points. And ask them if the narrative alone tells the story. Like if you read this description, do you know what we're planning? And then this is the timeline we have. So here we are on October 1st. That link to the RFA is out. The grant writing workshop, the grant applications are due by 5 p.m. October 31st. The system will close at 5 with no extensions possible. Follow-up interviews. So we will meet in between October 31st and January 13th and decide the committee. I think that's the next slide, actually. We'll talk about that. Follow-up interviews come January 13th. March 26th, we'll get notice of funding decisions. And then April 1st, the programs officially begin. So just so you know when you would get funding. The review process. So all applications are reviewed and scored by oversight committee members who do not have a conflict of interest. What this means is if somebody from Mental Health America is on our committee, they are not reviewing a proposal from Mental Health America. So then after everything is scored, then we discuss it as a whole. So everybody gets to participate. Actually, during that, even those people with conflicts excuse themselves from discussing their own work. SMART goals and narratives are weighted to be worth more than the budget and the overview. So we're really looking at those SMART goals and at that narrative. What is this project? Agencies are going to be invited to present their project and maybe provide some follow-up information if the reviewers have questions on January 13th, 2026. So just keep that date available so that we can get clarification and then make adjustments to scores if necessary. And then funding recommendations are going to be presented to the whole drug-free coalition on March 4th. So in summary, follow the instructions, be clear and concise and explicit in your answers, detail your budget and provide solid justification for how the dollars will be spent. View your application several times. And this is Rebecca's contact information, so call her.
Not on hand. I can send them out.
You need the new ICJI outline. And I say that only because coming from somebody who works for our police department now, knowing that they changed stuff around in the last couple of years, it looks like, from what Sharon and I looked at, it looks like law enforcement is actually kind of reversed and put into prevention now instead of justice services, whereas justice services is going to be more community corrections and reentry programs, and law enforcement is going to be more as prevention. So if you need those ICJI guidelines, let us know and Rebecca can send those out to you.
It is also broken down on the grant.
Okay, perfect. So so it would be intervention. Sorry, ICJI changed their guidelines and has kind of got us. I know because Will and I, for the longest time before I went to the police department, we were the ones doing law enforcement. So we were the ones grading those grants, and then all of a sudden it got flipped around and like, oh wait, you can't even do this part. So I just want to make sure that everybody has those guidelines and knows which one they should go into.
So, wait, so if you're going into the school to do an educational event or prevention, is that going under education or intervention?
Should go under education.
Yeah, okay.
According to
Prevention, that's called education.
their chart is a little.
Yeah.
So
Depending on what your prevention activity is. Prevention or. Or if you're trying to prevent those deaths by handing out Narcan, then that's an intervention. If you're doing a program to educate people to reduce risk.
Prevention, yeah.
Yeah, so prevention kind of can go in different places depending on what kind of prevention activity. But I know a lot of our prevention activity is educational.
because they have they have universal intervention, elective intervention, indicated intervention, and symptom identification, early treatment, later treatment, under treatment categories, and long-term treatment and support or ongoing care and support under justice services. So how they break it up, make sure, that's why probably here 22, and that's what yes, sure, there's not a new 2025 guideline, that everybody is has the same guideline. What has been using in the past?
Current amount, like, on how do they decide what amount of project they are.
I don't know.
We have, what was the amount that's written within this last year?
We usually get approximately between $145,000 and $150,000. In the few years that I've been involved, we've funded around 12, 13, 14 organizations with that.
There's no ceiling on it other than
Has to go, that has to be, that has to be split into each category. And that has to be split evenly. And it's a huge mess if we have to ask for, like, so if we don't, like, let's say we don't fund all of one category. Let's say justice services, we don't fund $20,000 of that. That doesn't roll to the next year's justice services. It rolls back in the pot and then gets distributed among the four again. So it's kind of a weird, if we have money left over, how it gets rolled.
so, but well, we can ballpark it's about 30,000, 35,000.
Yes.
So
Maybe a little bit.
yeah, so there's an absolute ceiling of that. However, in the past.
Earlier you said that projects begin. Checks are restricted. June.
Correct. So your grant will start April, but your funding by the time it comes from state to the county, from the county to us, we don't actually able to distribute checks until June. So you can start spending April 1st, knowing that your money is not coming till June. Correct. From
Technically, you are,
correct. And it depends on organizations. Some people can wait till June. If you have to start in April, then you know the money's coming in, can be a reimbursement. So as long as the receipts start April 1st or after, it can be applied towards the approved.
What will become time for measurable goal, like you said, it's.
So you could do it
12 months or?
You can do it however you want. If your goal is, if it's some kind of program that you want to run for 2 years, that is fine. We're probably going to follow you for 2 years to make sure that that happens. It does not have to say This is going from April 1st to March 31st. It doesn't have to be, but your receipts need to land April 1st to, your receipts need to land in there, but your SMART goal measurable, it could be a 90-day program. It could be a 6-month, it could be a 12-month, 18-month. You do not have to use that, but you do have to have your receipts in that.
So the grants received until March. March
Yes.
first of the next year.
March 31st.
31st.
31st of
Yeah.
next year.
Yes. 2027. March 30th, wrap my brain around that, but yes. Yes, March 31st of 2027. Did you have a question?
What per? Fair, right, student.
We need to get the program in April.
So you would know if you got, like, so if you were to get funded, you would know. So you would just cover that cost until you get that check in.
Or when the receipt not fall after April 1st for the airfare, because we've got to purchase.
But the travel is in April.
The travel is,
That is fine. That is fine. The travel is in April, so that's. We understand that. And the county operates the same way. We're used to that.
Or
I would only note to be mindful on that is there's no guarantee that your grant will be approved till March.
yeah, we understand. Yeah,
Okay.
and we may not get it.
continued programs of continuation. That's any program that's done in the past regardless of funding source. Or is that only pertaining to programs that have been funded by this particular grant or DOC?
So continuation program.
Okay.
But if you're proposing something that's including the outcomes.
Yeah.
Would be.
Yes, yeah, but we should not mark it, it's not funded by DOC in the past, we should not say. Okay, cool.
Is there any questions online?
We're down to 2 participants online, so I have not seen any questions come through yet.
Okay, well, for those of you that can leave, you can leave. Okay, for the meeting,
Take more
You got-
snacks and drinks.
more snacks and drinks. You got about 40 minutes before the meeting starts.
So, most of the